Okay, let me tell you why. I'm going to tell you why that's wrong. But it's a really subtle reason. Okay, so when my patients come back to clinic, they are just not doing what I tell them. And I don't understand that. I mean, it's funny. Okay, so what does everybody tell you? If you watch TV, you should take calcium and vitamin D, right? And that's a good thing, but it's not the best choice. Sorry. It's not the best choice for you. What is the best choice? And what's going on with calcium? What's going on with osteoporosis and vitamin D? What should you be doing? Let's talk a little bit about this. And we're going to talk about TUMS, which is calcium carbonate, which is not as well absorbed. Okay, so we're going to talk about calcium. We're going to talk kind of different flavors of calcium because calcium citrate is better absorbed, so you need less calcium citrate to help your bones than calcium carbonate. So then why does Dr. Rutledge recommend calcium carbonate? Why does Dr. Rutledge refer to himself in the third person? I pity the fool that talks in the third person. So let's talk about this. First of all, osteoporosis is a worldwide and nationwide problem. And lots of people suffer from the complications of osteoporosis with collapse of the spine, falls, and death because of osteoporosis. So we want to treat osteoporosis, and if you watch TV at night, you see lots of ads for the therapy of osteoporosis. And those therapies include calcium of some type. They include vitamin D, particularly because now we're recognizing that so many Americans are vitamin D deficient. So we want to include both those things. And we want to pay attention to other things that can make a difference, particularly stress on the bones. So we, as an American society, get a huge amount of calcium in our diet, but we have a high rate of osteoporosis. In part, that's because we're watching TV and sitting around. We need to put force across the bone to build bone. So for example, I can feed you all the calcium in the world into your leg, which is in a cast, and the bone will be resorbed if that leg is in a cast because you're losing calcium. You're not stressing the bone and the bone doesn't build. So we're going to talk about taking supplemental calcium and supplemental vitamin D, which we strongly recommend. The amount of vitamin D is probably going to be huge because so many of our patients are vitamin D deficient. And so we're now recommending pre-op that all of our new patients get a vitamin D level because we're finding that everybody post-op at 1 year is vitamin D deficient. So we really want to get everybody to get on that vitamin D supplementation. But as we said, we really need to get you outdoors. There is some question as to whether or not the oral vitamin D supplementation or shots of vitamin D can make up for being in the sun. Now, when we say get in the sun, we're not saying you go out and get a burn. Do not go out and get a burn. But every single day, you need to get in the sun. You need to get in the sun, you need to get in the sun, you need to get in the sun. And I know that's not convenient. The solution is, again, we want a Twinkie, a Diet Coke, and a vitamin tablet. And getting out in the sun is inconvenient sometimes. Get in the sun. That's very important. Now, what calcium should we take? Why do we say take TUMS instead of calcium citrate? Because the research shows calcium citrate is actually better at preventing bone resorption. The reason is because we're not just frightened in our patients about osteoporosis, we're also frightened about kidney stones. Our patients can get kidney stones. And the reason they get kidney stones is because they have trouble with a chemical that binds to calcium called oxalate. And in the urine, calcium plus oxalate causes the most common kidney stones in the United States and in our patients. Kidney stones, like osteoporosis, is also very common, and it can happen in our patients, and we don't want it to happen, and so we fear a lot of calcium and oxalate being in your urine. How can we stop that? Well, one, you could decrease the oral intake of calcium, but that's been studied and actually harmful, because when you decrease calcium intake, then things get worse with your bone. Your body takes bone calcium and puts it in the urine. So low dietary calcium does not help. You can decrease oxalate. And oxalate is in spinach and chocolate and things like that, so you can decrease your oxalate intake. That will be good. But one of the real positive solutions for preventing kidney stones of the calcium oxalate variety is to bind the oxalate in the gut before you absorb it. And we told you just a minute ago that calcium binds to oxalate in the urine. So if you take calcium in the gut, it can bind to the oxalate in the gut and prevent you from getting it in the urine. And calcium carbonate in Tums is less well absorbed than calcium citrate. So more of the calcium stays in the gut, can help bind oxalate and protect you from kidney stones. Plus, calcium carbonate in Tums is an antacid and can protect you from ulcers. So we recommend taking Tums and looking at your vitamin D level, and probably going to need some vitamin D, especially go outdoors, and especially stress by working on those bones to put force across the bone to stimulate the bone building hormones. So that's subtle, but that's the idea. Calcium carbonate is not as good for bones, but it's very good for bones, and it's better for protecting you from kidney stones. Kind of subtle, but... And everybody who comes back